Um, Maria, are you back?
Good afternoon, I'm here.
Hi, Maria. Renee,
I'm here. Thank you.
thank you, Renee. Indira, sorry, Indira's not here. Trevor,
Yep, here.
Trevor, thank you. Jesse,
Hi, I'm back.
thank you, Jesse. Jose, Jose, not back yet. KK,
Yes, sir. Present.
thank you, KK. Ricardo is back. I heard him. And I am here. And are we expecting any more members to join for the afternoon after NOON noon?
I thought that member Patel may be joining. I'll try to reach out and confirm.
Okay. And Jose, are you back? Jose? Jose may not be back. Okay. So before I turn the meeting back over to Chair Crawley, I would just like to actually take some things out of order. I was originally going to recognize our member Ricardo Sanchez at the end of the meeting, but he may have to leave a little bit earlier than anticipated. And I really didn't want to miss recognizing him in front of everyone here present. And so I'm going to take that out of order and I'm going to say a few words about our member, Ricardo Sanchez, for all those years of service. Ricardo has served on this very board since 2014. And he has been originally appointed by Governor Brown, and he has served tirelessly in this board, serving in numerous roles and mainly as a chair of Communication and Public Education Committee. His leadership, his application of law enforcement background, and his devotion to public service was sincerely and truly helped the board navigate some tough cases. This will be Ricardo's last meeting at this board. I am sure we will see him. He is going to be truly, truly missed. Unfortunately, we're not here in person to present you with this resolution, but you will be receiving a nice little resolution signed by the Department of Consumer Affairs Director as well as myself, which states, whereas Ricardo Sanchez faithfully served as a member of the California State Board of Pharmacy from November 12, 2014 to May 31st, 2023, and whereas Mr. Sanchez faithfully served the chairperson of the Communication and Public Education Committee from September 2017 to April 2023, as a member of the Communication and Public Education Committee, the Legislation and Regulation Committee, the Licensing Committee, the Enforcement and Compounding Committee, and the Standard of Care Ad Hoc Committee. Whereas throughout his years of service, he gave tirelessly of himself and his ideas and acted forthfully and conscientiously, always with the public interest and welfare in mind. Whereas he discharged those important responsibilities in a manner reflecting great credit upon himself and the board. And whereas his colleagues wish to express to him their high esteem and regard, therefore be resolved this 20th day of April 2023 that the members of the California State Board of Pharmacy express heartfelt appreciation to Ricardo Sanchez for the outstanding contribution he made during his term of service to the board. Ricardo, wish we can all clap and give you all the kudos and hugs. We
I
will
think we can.
sincerely miss you.
Well, thank
And
you. It's been eight years, believe it or not. It's been a long time, but it's been a great experience. I worked with some great individuals, and we obviously did a lot of changes, and I think it's for the better of California and it's our um, communities out there, especially our licensees. And one thing I'll take away from this is the great friendships and also the knowing that everybody's, believes in second chances. I've been 34 years in law enforcement as a police officer, and state investigator, but I do believe in redemption, and I know that a lot of the board members also believe in that. People do get a second chance, and I'm glad you guys all keep an open mind on that. But thank you so much, Sung-ho.
Thank you, Ricardo. Any other members want to say anything to our member Sanchez before? Well, I'm sure, I hope you all stay in touch. I'm planning on staying in touch with him, but just as a public acknowledgement, anyone would like to say anything?
This is Renee. I just want to say thank you for your service in law enforcement and also on the board. Good luck to you in the
Thank you.
future.
I might take a year back and reapply, so we'll see.
Hi, Ricardo. This is Maria. You were on the board when I started and welcomed me and helped to train me to be a good board member. So thank you.
Yeah, thank you. You've done a fabulous job, Maria. I think are you gonna do a second term on this? Maria? Or were you up with
Talk
me?
offline. Thank you.
Okay. Anyways, it's been a pleasure. Maria, thank you.
All right. Well, thank you, Ricardo. Really appreciate it. And when you have to leave, just say you are dropping off.
Yeah,
in
it's
the middle of
8
the
long
meeting.
years. Thank you.
Please let us know when you're dropping off. But we, again, really appreciate you. And it's been such a pleasure. I cannot believe time has gone by just so fast. All right. With that out of the way and sadness out of the way, we will go back to the seriousness of the meeting, and I will return the meeting back to
Hi. Hi,
Yes,
this is
Eileen.
Eileen Smiley. I just wanted to note that Jose de la Paz is back on, just for the record in the minute.
Okay, thank you, Eileen. Jose, could you just verbally confirm? Thank you.
Verbally confirming.
Thank you, sir. Appreciate that. So back to you, Chair Crowley.
Great, thank you, President O. So members, Assembly Bill 663 would allow a mobile unit deployed as an extension of a county-owned pharmacy to carry controlled substances approved by the FDA for treatment of opioid use disorder under specified conditions. This measure follows up on last year's provisions, which created the initial authority for the use of a mobile unit as an extension of a county-owned pharmacy. As a committee, we agreed with the staff recommendation and are amending that the board establish a support position on the measure. Recommending rather, sorry. The committee did not receive public comment on this measure. Committee members, do you have any additional comments? Thank you. Board members, any questions or comments? Thank you. With the committee motion serving as a motion, moderator, we are ready for public comment.
Thank you. I've opened that Q&A panel. If you'd like to submit a comment on AB 663, please submit the word comment through the text box in that Q&A panel. Or for call-in users, you may dial *3 to raise your hand. Our first comment comes from Paige Talley. Paige, I've sent the request to unmute your microphone.
California Council for the Advancement of Pharmacy, and we are in support of this legislation.
Thank you. Doing a quick check. I do not see any additional requests for comment on this item. Would you like me to close the public comment?
Yes, please. Thank you. President O, I turn the meeting over to you for the vote.
Thank you, Chair Crowley. Maria, how do you vote?
Yes.
Thank you, Maria. Renee, how do you vote?
Yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. Jesse, how do you vote?
Yes.
Thank you. Jose, how do you vote?
Yes.
Thank you. KK, how do you vote?
Yes.
Thank you. Ricardo, how do you vote? Right. He's still here for about another half an hour, but think we are okay, so we will go for my vote, and I vote yes. The motion passes. Back to you.
Thank you. Members, Assembly Bill 913 would require the board to license and regulate pharmacy benefits managers as specified. This bill would require the board to promulgate necessary regulations and prepare a report to the legislature on or before August 1st, 2025, and annually thereafter. As I stated yesterday, I agree with the comments from staff that implementation of the measure would be a significant undertaking, but has the potential to address significant patient care challenges that currently exist. The measure would also address inequities that currently exist in pharmacy reimbursement models. Board staff have been advised that this measure has become a 2-year bill. During our meeting, there was significant discussion by members and the public. Members noted agreement with the policy proposed, noting the policy is in line with the board's consumer protection mandate. Some members expressed concern establishing a position on a bill that will likely change over the coming months and how that could be problematic. The committee received public comment recommending that the board take a support position. One comment recommended that the board watch the measure, and another commenter recommended that the board establish a support if amended position. Ultimately, after considering the matter and comments received, the committee is recommending a support position on the measure in its current form. Committee members, do you have any additional comments? Hearing none. Board members, do you have any comments or questions? Thank you. With the committee motion serving as the motion moderator, we are ready for public comment.
Thank you. We've opened that Q&A panel. If you'd like to comment on AB 913, please type comment into the text box and submit that, or for our call-in users, you may dial *3. Our first comment comes from Michelle Rivas. Michelle, I have sent you a request to unmute your microphone.
Thank you. Hello again, everyone. Michelle Rivas with the California Pharmacists Association. We're the sponsor of the legislation. I just want to thank the committee for the recommendation, and we urge and respectfully request the board support of AB 913. We know we've got a lot of work to do on this bill, but we are committed to working with the Board of Pharmacy to make sure that we come up with a piece of legislation that is going to meet the intention, which is to create and provide patient safety and address some of the what we consider unfair business practices by some pharmacy benefit managers, and finally have some regulation and oversight on an entity that plays a significant role in pharmacy. And again, we thank you very much for the recommendation.
Thank you very much for your comments.
And seeing no additional requests for comment, would you like me to close the public comment?
Yes, please. Thank you. President O, I turn the meeting over to you for the vote.
Thank you. Maria, how do you vote?
Yes.
Thank you. Renee, how do you vote?
Yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. Jesse, how do you vote?
Yes.
Jose, how do you vote? KK, how do you vote?
Yes.
Thank you. Ricardo, how do you vote? Okay, moving to me, I vote yes, the motion passes.
Thank
All
you.
right, back to you, Chair.
Thank you, President O. Members, moving to Assembly Bill 1060, which would make legislative findings regarding the naloxone hydrochloride as a medicine that can counter overdose effects when administered timely to reduce opioid overdose deaths. The measure would prohibit the healthcare service plans, health insurance plans, and Medi-Cal from imposing a cost-sharing requirement, including a copayment or deductible for coverage provided, and shall require the plan to cover the cost of prescription or non-prescription naloxone hydrochloride. As I noted yesterday, while the FDA has recently approved the purchase of naloxone over the counter, there is a lot of unknown as to what the cost will be and what insurance will decide should someone get the medication as a prescription. During our discussion yesterday, members agreed that support of the measure is appropriate. Some members suggested that the measure should go even further and apply to all opioid antagonists to ensure upon approval of new products, those products would similarly be covered under the provisions of the measure. The committee received public comment in support of the measure. Following consideration of the measure and comments, the committee is recommending a support position. Committee members, do you have any additional comments?
Yes, this is Trevor Chandler. I just wanted to speak to how incredibly important this measure is, especially in our role on the Board of Pharmacy and protecting consumers in the light of the horrific opioid epidemic. We need to do everything we can to make sure that we're providing consumers and Californians with the tools they have at as low a cost barrier as possible so we can fight this overdose epidemic. So strongly in favor of this bill and strongly in favor of this motion to support it.
Thank you so much, Trevor. Perfectly said. Board members, do you have any questions or comments? Perfect. With the committee motion serving as a motion, moderator, we are ready for public comment.
Thank you. We've opened the Q&A panel. If you'd like to comment on AB 1060, please type comment into the text box of the Q&A panel and submit that. For our call-in users, you may dial *3. And I'll wait just a moment to see if we have any requests. And seeing none, would you like me to close the panel?
Yes, please. Thank you. President O, I turn the meeting over to you for the vote.
Thank you. Maria, how do you vote?
Yes.
Thank you. Renee, how do you vote?
Yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. Jesse, how do you vote? Thank you. Jose, how do you vote?
Yes.
Thank you. KK, how do you vote?
Yes.
Thank you. Ricardo? Still not hearing. I vote yes. The motion passes.
I'm here.
Oh, I figure Ricardo, you're but vote yes on this?
Yes, I vote yes.
All right. Thank you, Ricardo. Appreciate it. We're moving on. Next, back to you.
Great. Thank you, President O. Members, Assembly Bill 1286 is the board's patient medication safety bill. The measure was considered in Assembly Business and Professions Committee yesterday and passed out of the committee. I think this was actually 2 days ago, but it is my understanding amendments were made to further define the conditions under which a pharmacy may be closed to state that it may be closed if on the professional judgment of the PIC or pharmacist as specified, determined that the conditions present an immediate risk to the health and safety of patients, personnel, and pharmacy staff. The amendments would further specify that the pharmacy shall reopen as soon as reasonably possible upon abatement of issue. Another amendment relates to the staffing floor being established in the measure. As amended, there would be explicit language that provides authority for a pharmacist on duty to waive the requirement for additional staff. As I noted yesterday, as a member of the Medication Error Reduction and Workforce Committee, I'm excited to see the board's measure moving forward. The provisions in the measure have the potential to significantly reduce medication errors and improve patient care. As this is a board-sponsored measure, the committee did not take action. There was significant discussion during the meeting about the measure. Members noted excitement about the legislation and the positive impact the measure will have on patient care. Discussion included concern about the closing of pharmacies. Members noted that the recent amendments address those concerns. Some public comment received was in support of the legislation, with commenters thanking the board for its leadership. Other commenters indicated support while requesting amendment to exempt pharmacies operated as part of a general acute hospital from the medication error reporting, while other commenters requested that the board allow reporting to PSOs or patient safety organizations. The committee also received comments in opposition to the measure, indicating concerns with staffing floor being established in the measure and the pharmacy closure provisions. The committee also received comment requesting that an alternative means be identified for a consulting pharmacist working on behalf of a surgical clinic be provided an alternative to the current renewal requirement. As the legislation is currently pending, any changes to the legislation would occur through the legislative process. Committee members, do you have any additional comments? Hearing none, board members, any comments or questions? Thank you. Moderator, we are ready for public comment.
Thank you. We've opened that Q&A panel. If you'd like to submit a comment, please submit the word comment in the Q&A or dial *3 to raise your hand. Our first comment comes from Lindsay Golahorn. Lindsay, I've sent the request to unmute your microphone.
Thank you. Can you hear me?
We can hear you.
Okay, great. Thank you. Hi, Lindsay Golahorn again with the California Community Pharmacy Coalition. Thank the committee for the discussion on this bill yesterday, and I won't repeat the comments I made yesterday. I just want to note that we do have concerns, continue to have concerns with the pharmacist closure provisions of the bill and the staffing floor, even with the recent amendments that are in print today, but are committed to continuing to engage on this. Thank you.
Thank you. And our next comment comes from John Grubbs. John, I've sent the request to unmute your microphone.
Hi, thank you. John Grubbs here again, Chief Pharmacy Officer for University of California Health. I wanted to just make sure everybody was aware, and I'm sure you are, but this was certainly interesting to me, that the committee, the Medication Error Committee, had received a report from the Executive Director with the Alliance for Quality Improvement in Patient Safety. And in her report, she had a slide that was titled Unintended Consequence to State Reporting. And it said in that slide a number of things. One was that collecting events is just numbers, difficult to make meaningful improvements. Mandatory reporting to outside organizations will chill reporting by pharmacists in fear of reprisal. The proposal moves the community back to a shame and blame environment, a step backward in creating a safety culture. Small pharmacies may not be able to afford continuing to work with the PSO and meet state reporting requirements, loss of the learning system. And finally, the resources required of this proposal do not make sense given that pharmacies are already struggling with workforce shortage and poor economy. Our medical centers, our pharmacies, both the inpatient and community pharmacies, all report errors internally, and we have robust processes in place to analyze those errors and to make system improvements. And we feel like we have made a lot of meaningful improvements, and we really look forward to seeing improvements made by other community pharmacies as well. I'm just questioning whether this mandating reporting by those pharmacies is really going to achieve the intended consequences. So thanks for the opportunity to share these comments with you.
Thank you. Next comment comes from Michelle Rivas. Michelle, I have sent the request to unmute your microphone.
Thank you very much, Michelle Rivas, California Pharmacists Association. We do have a supportive amended position, again, around the PSO issue, but overall, we think this is a great piece of legislation. We think it's going to do a lot of wonderful things for pharmacy and continue to improve patient safety. So we're looking forward to working with the board to resolve our tiny little issue with the legislation. But again, overall, we think it's a wonderful piece of legislation, and we want to thank the board for their leadership in being willing to tackle so many very complicated and difficult issues. Thank you.
Thank you. One last check. It looks like that's our last request for comment on this item. Would you like me to close the Q&A panel?
Yes, please. Thank you. Members, Assembly Bill 1341 would establish temporary authority for pharmacists to furnish COVID-19 therapeutics until January 1st, 2025, under specified conditions. Pharmacists have been performing these functions under a waiver issued by the Department of Consumer Affairs, as well as provisions by the PrEP Act. This measure is being considered as part of the Assembly Appropriations Committee. Following consideration, the committee determined a support if amended position is appropriate, with the amendment to make the authority permanent. The committee also received public comment in support of the measure in the committee's recommendation. Committee members, do you have any additional comments? Thank you. Board members, any questions or comments? Hearing none, with the committee's motion serving as a motion moderator, we are ready for public comment.
Thank you. If anyone would like to comment on AB 1341, please utilize that Q&A panel to submit the word comment. If you're a call-in user, you may dial *3. And we'll pause for just a moment to allow for the submission of any requests. And seeing none, would you like me to close the panel?
Yes, please. Thank you. President O, I turn the meeting back to you for the vote.
Thank you so much. Maria, how do you vote?
Yes.
Thank you. Renee, how do you vote?
Yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. Jesse, how do you vote?
Yes.
Thank you. Jose, how do you vote?
Yes.
Thank you. KK, how do you vote?
Yes.
Thank you. Ricardo, how do you vote? I don't hear Ricardo. I vote yes, the motion passes.
Thank you. Members, Assembly Bill 1557 is also a board-sponsored measure. The measure will make permanent authority for a California licensed pharmacist to perform medication chart order reviews from a remote location within California, and on behalf of California licensed healthcare facilities licensed under the Health and Safety Code Section 1250 under specified conditions. As amended, the measure also includes an urgency provision. The measure enjoys support from several organizations. As the matter is board-sponsored, the committee does not have to take action on this matter. The committee received public comment in support of the measure. Committee members, do you have any comments? Thank you. Board members, any questions or comments? Thank you. Moderator, we are ready for public comment.
Thank you. I've again opened the Q&A panel. If you'd like to comment on AB 1557, please submit the word comment through our Q&A box or type *3 to raise your hand. Our first comment comes from Stephen Gray. Dr. Gray, I have sent you the request to unmute your microphone.
Yes, thank you for the opportunity on this very important measure. I speak in support, very strong support of this to move forward with what pharmacists really need to do as reflected in federal law and accreditation standards, which is to make sure that every order for a medication, absent some absolute urgency like a heart attack, has to be reviewed by a pharmacist. And so I support going forward with this legislation, but I want to caution the board. I think there has been, and hopefully this will be taken helpfully, as I have talked to various hospital pharmacy directors and others, there is confusion in the terminology. And I think that's interfering with some of the communication. The chair of this committee just said that the bill is intended to allow pharmacists to review orders. The bill doesn't say review orders, it says verify. And verify in the outpatient means that an environment that a pharmacist has made sure that the right pill is in the bottle, that the directions for use are appropriate on the label, etc. But verify in this context means what the chair said. They have reviewed this from a DUR point of view and made sure it's the appropriate ordered drug in the appropriate dosage and length of therapy going forward. The hospital pharmacists, with rare exceptions, do not have a way to verify that after they've reviewed it and said this is appropriate, that they actually verified that the right drug was selected from the Pyxis machine or the right things were put in the IV bottle by the technician. They don't do that remotely. And so it's very important to, when we're talking about remote processing, to be very explicit and not use summation terms like review and verify, but make sure every person understands the exact tasks that we're talking about. So what the pharmacists do when they review an order for a hospital patient, they're offering an opinion, a professional judgment opinion that based on the information they have been given, this is an appropriate order for that particular patient. But they're not verifying that the nurse picked the right drug from the Pyxis or that it was administered in the right way, et cetera. And so it's really a different task than someone remotely verifying orders in an outpatient setting. Thank you for the ability to comment.
Thank you for your comment.
And double checking, it looks like that is our only comment on this item. Would you like me to close the panel?
Yes, please. Members, did you have any other comments after receiving public comment? Okay, hearing none, we'll move on to the next one. Members, Assembly Bill 1619 has become a 2-year bill, and as such, unless members have any comments, I will move to the next item. Great. Senate Bill 339 would authorize a pharmacist to furnish up to a 90-day course of PrEP or beyond under specified conditions. It would require the board to adopt emergency regulations by July 1st, 2024. Further, it would require health plans and health insurers to cover PrEP and PEP, including medications furnished and tests ordered by pharmacists as specified. The bill addresses some of the challenges discussed during the Licensing Committee's recent post-implementation discussion on pharmacist-provided PrEP and PEP. Further, it updates the law to allow for flexibility in treatment by removing the specified type of PrEP authorized to be furnished. It also provides a mean by which a pharmacist can continue to provide care beyond the 90 days under specified conditions, including that a patient receives testing and follow-up care consistent with the CDC guidelines. The measure will be considered in the Senate Health Committee hearing on April 26, 2023. Members, the measure appears to enjoy broad spectrum support from a number of organizations, but has opposition from the American College of Obstetrician and Gynecologists and the California Medical Association. During the meeting, members noted support of the measure, indicating that there are real gaps in healthcare. Members noted that other states have eclipsed California in expanding access. Public comment was also provided in support of the measure. The committee also received public comments suggesting that the board should establish a support if amended position and request that the measure be amended to provide pharmacists the authority to order tests specified in subsection F1 of the language. Following consideration of the matter, the committee is recommending a support position. Committee members, do you have any comments?
This is Trevor Chandler. Just want to say I'm fully in support of this bill and of this motion. Every diagnosis of HIV and AIDS in this state that we have is a travesty, and we need to remove as many barriers to both prevention and reaction for both PEP and PrEP as possible. And just think this is a common sense action we can take to fight back against this epidemic that's still ongoing across California and across the country. And as was mentioned, California had established a leadership position on HIV/AIDS prevention and response, and we've since lost that leadership to states like Washington and Denver. And so this is an important first step to us reestablishing our groundbreaking leadership when it comes to fighting back against HIV/AIDS. So thank you.
Thank you, Trevor. Board members, do you have any questions or comments? Great. With the committee motion serving as the motion moderator, we are ready for public comment.
Thank you. We've opened the Q&A panel. To comment, my apologies, on SB 339, submit the word comment through the Q&A panel or type *3 to raise your hand. Our first comment comes from Michelle Rivas. Michelle, I have sent the request to unmute your microphone.
Thank you. Michelle Rivas, California Pharmacists Association, we're the sponsor of the bill. I want to thank the Legislative Committee for your recommendation of a straight support for this legislation. We are excited to keep moving the bill forward and finally meet the intention of this legislation, which is to increase access points for this life-saving medication. So again, thank you so much for your support, and we respectfully request the board's approval of the committee recommendation. Thank you.
Thank you. Our next comment comes from Keith Yoshizuka. Keith, I've sent the request to unmute your microphone.
Thank you for the opportunity. Keith Yoshizuka, California Society of Health System Pharmacists. We also support the passage of this bill, but to address one of the comments made about the authorizing the pharmacist's ability to order the test. I believe that the board sponsored legislation, was it last year or a year before, to perform tests for infectious disease. And I don't think there would be anyone that would disagree that HIV falls within that category of infectious disease. So pharmacists do have the authority to order those tests. Thank you very much.
Thank you. And it looks like that's our last comment. Would you like me to close the panel?
Yes, please. President O, I turn the meeting over to you for the vote.
Thank you. Maria, how do you vote?
Yes.
Thank you. Renee, how do you vote?
Yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. Jesse, how do you vote? Thank you. Jose, how do you vote?
Yes.
Thank you. KK, how do you vote?
Yes.
Thank you. Ricardo, how do you vote? No vote. So I vote yes, the motion passes. Back to you.
Great, thank you. Members, Senate Bill 345 would prohibit a board from suspending, revoking, or denying a license from a person based solely because the licensee provided legally protected activity as defined. Legally protected activities include the exercise of rights related to reproductive health care services or gender-affirming healthcare services. During the meeting, members noted concern with actions being taken in other states and the need for the board to support the measure as a means to convey its policy in the area. Members noted that the services covered in the measure are essential for patient care. Public comment suggested the board should only establish a support if amended position to ensure pharmacists are covered. Other public comments suggested that the board currently automatically disciplines a licensee that is disciplined in another jurisdiction. It was clarified that the board does not take automatic action based on discipline in another jurisdiction. Rather, the board evaluates an issue to determine if action is appropriate and, if so, follows the process required in the law. Following consideration of the matter, the committee is recommending a support position. Committee members, do you have any additional comments? Thank you. Board members, any questions or comments? Thank you. With the committee motion serving as the motion, moderator, we are ready for public comment.
All right, we have opened the Q&A panel. To comment on SB 345, you can submit the word comment through our Q&A text box or dial *3 to raise your hand. Our first comment comes from Keith Yoshizuka. Keith, I've sent the request to unmute your microphone.
Keith Yoshizuka, California Society of Health System Pharmacists. I did so yesterday, and I will again request that pharmacists be added to the list of healthcare providers who are protected while performing legally authorized tasks and duties in the state of California that may have been prohibited in other states. Thank you.
Thank you. And I'm quickly checking to see. Looks like that's our only comment. Would you like me to close the panel?
Yes, please. Thank you. President O, I turn the meeting over to you for the vote.
Thank you, Chair Crowley. Maria, how do you vote?
Yes.
Thank you. Renee, how do you vote?
Yes.
Thank you, Trevor. How do you vote?
Yes.
Thank you, Jesse. How do you vote?
Yes.
Thank you, Jose. How do you vote?
Yes.
Thank you, KK. How do you vote?
Yes.
Thank you, Ricardo. How do you vote? No vote. And I vote yes. The motion passes. Back to you.
Thank you. Senate Bill 427 would prohibit prior authorization or step therapy for medications approved for the prevention of AIDS or HIV under specified conditions. The measure would allow for prior authorization or step therapy if at least one therapeutically equivalent version is covered without prior authorization or step therapy. During the meeting, members noted agreement with the policy goal of the measure, but do not believe it goes far enough. Members noted that the requirement should be expanded to include more than a single therapeutic. Following consideration of the matter, the committee is recommending a support if amended position. Committee members, do you have any additional comments? Hearing none. Board members, any comments or questions? Thank you. With the committee motion serving as the motion moderator, we're ready for public comment.
Thank you. And our Q&A panel is open for those who would like to submit a request for public comment. You can send the word comment through the Q&A text box or dial *3 to raise your hand. And I'm not seeing any requests at this time. Would you like me to close the panel?
Yes, please. Thank you. President O, I turn the meeting back to you for the vote.
Thank you. SB 427. Maria, how do you vote?
Yes.
Thank you, Renee. How do you vote?
Yes.
Thank you, Trevor. How do you vote?
Yes.
Thank you, Jesse. How do you vote?
Yes.
Thank you, Jose. How do you vote?
Yes.
Thank you, KK. How do you vote? Thank you, Ricardo. How do you vote? No vote. I vote yes. The motion passes.
Thank you. As amended, Senate Bill 524 would establish authority for a pharmacist until January 1st, 2034, to furnish specified medications based upon test results received for specified illness, conditions, or diseases. Specific illnesses include COVID-19, influenza, streptococcal pharyngitis, sexually transmitted infection, and conjunctivitis. It would require the board to develop standardized procedures and protocols with the Medical Board of California. It would also require a pharmacy or healthcare facility in which a pharmacist is providing such treatment to provide an area designated to maintain privacy and confidentiality. It would require the documentation to the extent possible of the testing services provided in a record system maintained by the pharmacy. The measure would specify the provisions established are covered under Medi-Cal. The measure recently passed out of the Senate Business and Professions and Economic Development Committee and is scheduled to be heard in the Senate Health Committee on April 25th. The measure has several entities supporting the measure, including the California Pharmacists Association. The measure is sponsored by the California Community Pharmacy Coalition, which is a project of the California Retailers Association. There are several city governments that are supportive of this measure. I note there is opposition to this measure, including opposition from the California Medical Association and UFCW. There was significant discussion on this measure during our meeting yesterday. Generally speaking, members agreed that patients would be well served by pharmacists performing these services. However, members also expressed significant concern with the working conditions in community pharmacies and if conditions currently would promote quality access to care. I shared my personal experiences currently working in the environment and the challenges that create risk to patients when pharmacists are going in and out of providing patient care services while balancing other duties. I believe the proposed authorizations covered in this measure are appropriate and consistent with a pharmacist's knowledge, skills, and abilities. I'm just not confident that the pharmacists working in community chain pharmacies currently have the appropriate staff to support providing these services in the best interest of patients while also balancing the other workload pharmacists currently have. Members agree that the expansion of care, especially in rural communities is needed. Some members suggested that staffing issues need to be addressed first and noted the board's measure, AB 1286, would address the staffing challenges. Members noted that the legislation itself does not create a mandate to perform services, but indicated that from a practical standpoint, employers could require it. The committee also received significant public comment, including from the California Community Pharmacy Coalition, who are the sponsors of the measure. They noted that the measure is about healthcare access and indicated that they are willing to work with the board on concerns in hopes that the board can come to a support position. Other comments spoke in support of the measure. One commenter noted challenges with one of the provisions in the measure requiring the board to secure approval from the medical board on required protocols. Members also received public comment from UFCW indicating that their established position was an opposed unless amended position, with amendments to require an additional pharmacist at the pharmacy providing the services. After considering all of the comments and discussion, the committee is recommending a watch position on this measure. This will allow the board to monitor the progress of AB 1286. Members noted that as part of the communication to the author's office regarding the established position, it would be appropriate to convey that the board supports the concept of the measure and policy, but cannot support the measure at this time because of the working conditions that currently exist, placing patients at risk. Committee members, do you have any additional comments? Hearing none, board members, any questions or comments? Thank you. With the committee motion serving as a motion, moderator, we are ready for public comment.
Thank you. If anyone would like to comment on this bill, please use the Q&A panel to send the word comment or raise your hand by dialing *3 for calling users. Our first comment comes from Sarah Polomu. Sarah, looking for you. Oh, there you go. I've sent you a request to unmute your microphone.
Hear me?
We can.
This is Sarah Polomu with the California Community Pharmacy Coalition, which is a sponsor of SB 524. We appreciated the discussion on this bill in the Legislation and Regulation Committee yesterday. This bill is a healthcare access measure, given that millions of California residents live in areas of the state that are designated as healthcare professional shortage areas with a lack of available primary care providers and hospital closures. This is especially true in rural areas of California. On the other hand, the vast majority of Californians live within a few miles of a community pharmacy and receive a number of healthcare services from pharmacists in addition to their medications. Unfortunately, when a patient has symptoms for common conditions, they have to wait to see their primary care provider to receive treatment, even though their pharmacist can test for these conditions. For many individuals, getting an appointment can take days or longer. SB 524 will give patients the option to visit their local pharmacy to receive both testing and treatment in a matter of minutes for COVID, flu, strep, conjunctivitis, and STIs. This bill is a modest expansion of pharmacist duties that will have a significant positive impact on access to care and health outcomes. We see this as the natural next step after the board-sponsored bill from 2021, SB 409, was enacted, allowing pharmacists to perform CLIA waived testing. And because pharmacists have already been independently dispensing Paxlovid to treat patients with COVID, SB 524 simply codifies that authority and narrowly expands it to allow pharmacists to furnish straightforward treatment for 4 other common conditions. We have been working with the opposition, and the bill has been significantly pared down from its original version and is focused on just those 4 conditions plus COVID. Amendments are also added privacy requirements for patients receiving treatment and a statewide protocol for training. For these reasons, we hope that the board can come to a support position on this. The California Community Pharmacy Coalition is willing to work with the board on any concerns you have. Thanks so much.
Thank you. And our next comment comes from Keith Yoshizuka. Keith, I've sent the request to unmute your microphone.
Keith Yoshizuka, California Society of Health System Pharmacists. I'm urging the board to take a support position on this bill. It broadly expands patient access to primary care, even though it's been pared down. It's fitting that this is the 10-year anniversary of the passage of Senator Hernandez's SB 493, which greatly expanded pharmacists' authority to serve the public. Since that time, we've lost ground, and several other states have passed legislation to allow pharmacists to test and treat. This is a modest increase. There are other avenues to address the issue of workload and safety that the board has already instituted, and there are even more protections pending given the current legislation. So I would urge you, please, to take a support position on this bill, because it would dramatically increase the access to patient services, not only in rural areas, but in the inner city for those affected individuals. Thank you.
Thank you. And our next comment comes from Jeff Olson. Jeff, I've sent the request to unmute your microphone.
Hi, thank you for allowing me to speak. I do feel the board needs to support this bill. It does expand the access to care for a lot of patients that one can't get in to see their doctor, or it takes a long time for them to get that care. But if they're in a pharmacy and a pharmacist can provide that service to them and care and treatment, it will help with the outcome for that patient. As for the comments about chain pharmacies and staffing, I would refer back to AB 317 that would allow us to be reimbursed for those type of services, and that could help fund additional staffing in this case. So that was just my comment. Thank you.
Thank you. And our next comment comes from Jazzy Graywall. Jazzy, I've sent the request to unmute your microphone.
Chair and board members, Jazzy Graywall with UFCW Western States Council. UFCW does not disagree with the intent of the proposal, which is to provide access, healthcare access in rural communities. However, our concerns lie squarely in the fact that pharmacists currently do not have adequate staffing to complete their workload and do not have autonomy over workflow decisions. The services that would be provided under this proposal and treatment plans take time to take a test. Some of these tests take about 15 minutes to turn around. So you have a pharmacist constantly breaking workflow to be with the patient. Then they have to analyze the test, get the patient's files, their previous medical history, develop a treatment plan, answer questions on behalf of the patient. All these services are very time intensive, and then have to jump back into workflow to do ancillary services or prescription services, often as one pharmacist by themselves with minimal tech hours or clerk hours assisting them. So we have significant concerns. There's been a lot of discussion about AB 1286, the board-sponsored bill, as a vehicle to help with the workforce conditions. However, that bill has not passed. It still has quite a legislative process to complete. And so we don't know what the final state or the final version of that bill is going to look like. So to rely squarely on that proposal to address the workforce issues is not we would say is not the best avenue to do so. That is why UFCW is requesting an amendment. We are currently opposed unless amended to SB 524 that would require an additional pharmacist in the pharmacy to provide only the clinical services authorized by this bill. This ensures that pharmacists who are overworked and understaffed on their current workload duties do not need to break workflow to assist patients and offer treatment on the illnesses and conditions which are time extensive under this proposal. This amendment ensures that pharmacies can provide the highest level of patient care and services delivered by pharmacists whose sole focus will be testing and treating illnesses and conditions provided under this bill. We do not think it's unreasonable to ask for an additional pharmacist to provide these lengthy services to be able to complete the tasks that are necessary. Rural communities deserve good access to care, quality access to care, and that's what we hope the additional pharmacist will provide. I appreciate you all allowing me to make comment today.
Thank you. Our next comment comes from Stephen Gray. Dr. Gray, I've sent the request to unmute your microphone.
Thank you again. I support the intent of this bill. It's really needed, and it's needed mostly in underserved areas or in congested areas or in areas affected by unusual transportation challenges or weather, for an example. I point out that other states have already moved, as was noted, to having pharmacists being able to test and treat. And for such conditions as streptococcal pharyngitis or flu, et cetera, there has been a huge benefit to the overall health of Americans because of that. And that is that in states where pharmacists were allowed to test a virus or to determine whether it was a virus or a bacteria, the inappropriate prescribing of antibiotics has decreased in some cases by over 50%, which in the long run will prevent bacteria from becoming resistant to those antibiotics. So that's an additional benefit from this bill that should be noted and should be remembered. I also, though, did comment yesterday that I think that with the Board of Pharmacy's position during the Sunset Review and the adoption of AB 1533 of moving forward with the standard of care position, that the board no longer needs to have the medical board agree to every standardized procedure and protocol. The board is perfectly capable of pulling together the proper expertise and developing standardized procedures and protocol if in fact that's what the board decides to do, and has been proven pulling together if standardized training is needed in their opinion. So I would, as the board moves forward, I would urge support in concept and also, but to take into consideration removing that impediment. It also places a delay and a burden and an updating problem with if a standardized procedures and protocols have to be agreed by two separate boards. Thank you very much.
Thank you. And our next comment comes from Mark Johnston. Mark, I've sent the request to unmute your microphone.
Health, I urge the board to support this bill and to support expanded pharmacist practice, just as the board has done for 10 straight years. A vote by pharmacists, a vote by the Board of Pharmacy to not support expanded pharmacist practice would certainly have ringing effects around America as the other states look to California, certainly no longer as a leader in pharmacist expanded practice, but the exact opposite, as a board that has made a regressive move to not support expanded pharmacist practice. When the board makes decisions, they have to weigh the pluses and minuses. And I understand there are concerns about working conditions by the board in California. Do those concerns over a few pharmacies in California outweigh the overwhelming benefit to millions of citizens? The board's job is to not protect pharmacists, it's to protect the citizens of California. And the decision should be an easy one to support the citizens of California by supporting this bill, by supporting the practice of pharmacy. And I am perplexed by the board not taking a support position on this bill when the reasons for exist when furnishing HIV prophylaxis, when furnishing naloxone, two bills that the board just took positions of support on. However, this form of expanded pharmacist practice, the board would make a really revolutionary decision to step backwards. Thank you.
Thank you. Do one last quick check. Looks like that is it for our comments at this time. Would you like me to close the panel?
Yes, please. Thank you so much. And thank you everyone for those comments. We really appreciate the engagement on this topic. It's definitely one that we have to think about and ruminate about. So I'll first open it back up to members to see if anyone has any additional comments.
Hi, Dr. Crawley. This is Maria. We heard testimony yesterday and again today that has me kind of rethink a little bit about our position. I think during our discussion, we talked about supporting the concept, but we had serious concerns about dangers that could be in place for pharmacists being overworked or potentially being forced to comply with new practice needs without sufficient support. And I think those are serious things that we do need to consider. But the overall goal of this bill is a positive one. And so I would suggest that we look at maybe changing our recommendation to support if amended and have those amendments be there to provide the safety and support that's needed, but supporting the concept of pharmacists being involved with testing and treatment.
Thank you, Maria. Any other member comments?
Yes, Jessica, KK here. Same thing as Maria said. I also mentioned yesterday, we probably want to decouple the expansion of practice of pharmacy with the concern, which are valid concern about the staffing and pharmacist availability to do those things satisfactorily. Those will be, in my opinion, something that can be looked at with a different lens, rather than we should, at least in the case of 524, look at it as a expansion of duties or expansion of services that we can provide, especially the rural counties and rural areas. I'm resident of one of them. That definitely helps.
Great. Thank you, KK.
Thank you.
Hi, this is Trevor Chandler. I just want to say I believe that in many ways the board and the committee has already taken a support if amended position with our introduction of 1286 and the staffing concerns that we have there. And I think this, if we were to have a support if amended position on this without 1286 being in place first, that really is the prerequisite. And the fact that 1286 has a long road to hoe still, I think we need to make sure that gets passed as a board priority and a piece of board legislation to make sure that we first address the staffing issue and we don't put the cart before the horse, or we in this case, put the cart next to the horse as we're trying to deal with two major issues. So while the intent of the bill, obviously to provide flexibility especially in rural areas, is important, I support our current recommended position of watch, given that we still haven't resolved the staffing issue that 1286 is working to resolve. So I would recommend keeping our recommended position of watch rather than changing it.
Great. Thank you, Trevor. Any other member comments?
This is Maria. I just wanted to state one more thing. Historically, I mean, this is a long time back when I was a new pharmacist, we had legislation that allowed pharmacists to provide clinical services. And that was a big step forward. And part of that was requiring that technicians didn't take over those duties, or people weren't fired or laid off in order to perform additional functions. And so those safeguards could be put in place also with this kind of bill. So saying, you know, such that these services would be allowed only if this and that and this are available. So that's another way to consider it. I don't think they need to be totally separate. I think safeguards could be included in this amendments that would make this what we want to improve patient access, improve pharmacy services in a safe environment. So that's just another thing to consider with our potential amendments.
Yeah, and just to add one more thing, last thing, is to Trevor is right, you know, the putting the cart next to the horse or whatnot. But again, all those activities that pharmacists currently providing, or all the services pharmacists are currently providing, are contingent upon that there's a conducive environment to do that job. So I don't think that expanding or asking or continuing to do the testing and treatment services takes out those conditions or necessary conditions for satisfactorily working. So professional environment, adequate help, there are adequate measures already there, like ratios and stuff. So again, if it requires that 1284 also passes, I think that is also a desired outcome we are looking at. But I think expansion of duties, especially the needy areas, I don't think it's sequential, or I think it can at least, if not sequential, it at least can go parallel and have both have a desired outcome in a timely fashion. I hope I make sense.
Yeah, that makes sense. Thank you, KK. Any other comments? Okay, I will just say overall, I'm still torn on this measure. I do still agree with everyone that access is important. However, being in the actual chain retail pharmacies every day, knowing how many additional duties we continue to put on our plate, and knowing that there are times where I am constantly being pulled back and forth and not giving 100% of my focus onto one thing, I am very nervous with the conditions that exist in terms of the quality of care that I provide patients. And I want to be sure that we're not providing suboptimal care, specifically in rural communities, but also in the inner cities where there's often marginalized communities like Black, Latino, and Indigenous communities who are already receiving suboptimal care, and statistically from what we can see in healthcare. I also just want to comment on one of the comments received, stated that the goal of this measure is to help provide patients a way to get tested and get treatment in a matter of minutes in the pharmacy. And I think that's exactly the problem and the reason for the hesitancy for establishing a support position. There is a lot of pressure already on our chain retail pharmacists, and I'm not sure how much more they can actually do. Just referring to some of the well-being indexes, we know that being burnt out does increase medication error. And so I want to be cautious as we move forward. I want to make sure that we're being intentional as we expand access and patient care services. So with that, any other comments before I turn it over to President O? Okay, President O, I'll turn the meeting over to you for the vote.
Thank you, Chair Crowley. I think the motion is to see if you are going to be okay with watch position for this vote. It's watch position. And Maria, how do you vote?
No.
Thank you. Renee, how do you vote?
Yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. Jesse, how do you vote?
Yes.
Thank you. Jose, how do you vote?
Yes.
Thank you. Jose. KK, how do you vote?
Nope.
Thank you. Ricardo, how do you vote? If you are still here, I know he has to leave very soon. He is not here. No vote, Ricardo. I will vote yes, but I do really wish to support this bill at one point. I'm hoping that we can get there. I really do. So with that, I will turn back over to you, Chair Crowley.
Thank you. Members, Senate Bill 544 would create permanent authority for remote board meetings under specified conditions. The measure will be heard in the Senate Judiciary Committee, April 25th. Members spoke in support of the measure and noted that the measure creates equity by allowing individuals to participate. The committee did not receive any public comment on the measure. Following consideration, the committee is recommending a support position. Committee members, do you have any additional comments?
I'll just say one of the things one of my main takeaways from the meeting yesterday was the accessibility for folks with mobility issues, neurodivergence issues, which is something that obviously that I don't deal with, and it wasn't on the front of my mind. So I just really appreciated the comments at the committee meeting yesterday about how this will impact folks and allow both folks with mobility, neurodivergence, and whatnot to be a part of board meetings. So I fully support this.
Thank you. Board members, any questions or comments? Thank you. Hearing none, with the committee motion serving as a motion, moderator, please open the line for public comment.
Thank you. I've opened that Q&A panel. If you'd like to comment on SB 544, please type comment into the Q&A text box, or you may dial *3 for a call-in user to raise your hand. All right, and seeing no requests, would you like me to close the panel?
Yes, please. Thank you. President O, I turn the meeting over to you for the vote.
Thank you. With SB 544, Maria, how do you vote?
Yes.
Thank you, Maria. Renee, how do you vote?
Yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. Jesse, how do you vote?
Yes.
Thank you. Jose, how do you vote? Thank you. KK, how do you vote? Thank you. And Ricardo, no voting. I vote yes. The motion passes.
Thank you.
Back to you.
Senate Bill 826 would establish a process for the board to receive subsequent arrest notifications from the FBI. As I stated during the committee meeting, I agree with the comments included in the meeting materials, including acknowledging the inequities that exist within the criminal justice system. However, given the board's consumer protection mandate, I support the measure. I think supporting this measure is appropriate. The committee did not receive any public comment on the measure and is recommending the support position. Committee members, do you have any additional comments? Board members, any comments or questions? Thank you. Hearing none, with the committee motion serving as the motion, moderator, we are ready for public comment.
Thank you. We've opened the Q&A panel. If you'd like to comment on SB 826, please type the word comment into the Q&A text box, or for calling users, you may dial *3 to raise your hand. And seeing no requests, would you like me to close the panel?
Yes, please. Thank you. President O, I turn the meeting back to you for the vote.
Thank you, Chair Crawley. 2 more to go, everyone. Almost there. SB 826. Maria, how do you vote?
Yes.
Thank you. Renee, how do you vote?
Yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. Jesse, how do you vote?
Yes.
Thank you. Jose, how do you vote?
Yes.
Thank you. KK, how do you vote?
Yes.
Thank you. I think Ricardo has to leave. I'm going to skip him and I vote yes. The motion passes. Back to you.
Thank you. Excuse me. Okay. The Senate Bill 873 would require the cost-sharing savings of a prescription drug based on rebates received to be calculated at the point of sale as specified by requiring the healthcare service plan or insurer to provide the information to the dispensing pharmacy. The measure was considered yesterday as part of the Senate Health Committee hearing. Members noted agreement with the concept, but expressed concern that with more specificity in the measure to explicitly state that pharmacy benefit managers are responsible for calculating this information for pharmacies, it could foster conditions for clawbacks by PBMs. Public comment also suggested that the measure in its current form is unclear regarding which entity is responsible for making the determination at the point of sale. Following consideration of the issue and comments, the committee is recommending a support if amended position with amendments to require more specificity regarding the obligations of the PBM to provide the necessary cost-sharing information for the pharmacist to use. Committee members, do you have any additional comments? Thank you. Board members, any comments or questions? Thank you. With the committee motion serving as the motion moderator, we are ready for public comment.
Thank you. And our Q&A panel is once again open. If you'd like to comment, please type comment into the text box. If you'd like to raise your hand, please dial *3 if you are a calling user. And our first comment comes from Keith Yoshizuka. Keith, I've sent you the request to unmute your microphone.
Keith Yoshizuka, this time speaking as an individual. I see a logistical problem in requiring point of sale. This is, I think, this bill was introduced a couple of years ago in maybe in a different form, but it's difficult to calculate what the rebate would be at point of sale if the rebate is contingent upon achieving a certain market share at the end of the quarter. So how is the PBM, much less the individual pharmacy, going to determine if the goal has been met 3 months in advance? Is logistically impossible. Thank you.
Thank you for your comment.
And it looks like that is our only comment on this item. Would you like me to close the panel?
Yes, please. If there are no additional member comments, then I'll turn it back over to President O for the vote.
Thank you, Chair Crowley. Maria, how do you vote?
Yes.
Thank you. Renee, how do you vote?
Yes.
Thank you. Trevor, how do you vote?
Yes.
Thank you. Jesse, how do you vote?
Yes.
Thank you. Jose, how do you vote?
Yes.
Thank you. KK, how do you vote? Thank you. And I vote yes, the motion passes. Back to you. Any
Thank
closing
you.
items for you?
Getting to the regulations portion. So similar to the meeting yesterday, the remaining items are for information only. As detailed in the meeting materials and associated attachments, the board has several regulations in various stages of promulgation. I do not intend to review each item as the information is contained in the public materials. I know that the board that currently has 4 regulations undergoing pre-notice reviews by the Department of Consumer Affairs or Business Consumer Services and Housing Agency. Additionally, staff are reviewing the comments provided by DCA related to the board's proposed changes to its disciplinary guidelines. Staff are working on drafting regulation documents for 5 regulation packages, including 1 regulation package to update self-assessment forms via the Section 100 process. Members, do you have any questions or comments about the regulations? Hearing none, moderator, please open the line for public comment.
This is the moderator. Our Q&A panel is open. If anybody would like to comment on the 4 regulation packages up for discussion, you can type the word comment into our Q&A text box, or for our calling users, you may dial *3 to raise your hand. And seeing no requests, would you like me to close the panel?
Yes, please. Thank you. President O, that concludes my report. I'll turn the meeting back over to you.
Thank you, Chair Crowley, and all the committee members for all you do. It was always great job. All right, we're almost there, everyone. Now next agenda item is Ann's Executive Officer Report. Miss members, I'll turn the meeting over to our Executive Officer, Ann Sodergran, to provide a brief report. I think if you can proceed with a slide, moderator, please.
Thank you. I'll keep my comments brief. It's been a long day. The first thing is it's really just more for situational awareness to make sure that everyone's aware that there will be changes in the cure system. DOJ should be releasing information. We would strongly encourage licensees to monitor the DOJ website because the version of ASAP will be changing in August of next year, as I understand it. So I wanted to put that on for situational awareness. Also, we have been, with graduation season coming, we have been giving a number of presentations to schools of pharmacy and their graduating classes to help them understand the licensee process and some common pitfalls that they can avoid through the application process. You know, students have worked really hard to get to where they are in their careers. And so if we can help push them over the finish line by helping them avoid some of the common pitfalls with the application and testing process, we're trying to do that. Also had the opportunity to present a lot of the board's efforts with respect to medication errors at a patient safety conference in March. And then the last item is every 6 months, we do provide the passing rate information for both the California Pharmacist Licensure Exam, the CPJE, as well as the NAPLEX exam. So that information is included. Just quick highlight. So we provided a little bit of comparison data to the same time last year. What you'll notice is that the CPJE has actually had a pretty big increase. It's gone up about 14 percentage points from the same time last year in terms of passing rates. Whereas for the NAPLEX has actually gone down. The passing rate for the NAPLEX has actually gone down about 10.4 percentage points. So in the committee materials, it talks about those percentages of increase. I'm just talking to you a little bit about those percentage point increases. So that's just kind of some interesting trends. Staff will definitely continue to monitor for those trends. And that's my report. Thank you for your time.
Wow, Ann, I didn't think it was going to be that short, but thank you for just zooming through the portion of it. I will open up for public comment and also, oh, well, before members, any questions for Ann?
Yeah, this is Trevor Chandler. And curious because I mean, I've always been told that California has one of the toughest or most comprehensive examinations for pharmacy. And so, how does if this is applicable, how does the California exam in toughness compare to the North American exam? Is there just wondering what the dynamic is between the two that would account for so many more people being better at California, but also not doing as well on the North American test?
Yeah, so Trevor, that's kind of an interesting question. So by law, so the statute in California determines the types of things that are included on the CPJE. And we have this whole psychometric process that we need to follow, including occupational analysis, surveys, lots of different things to determine that our exam is psychometrically sound. So we go through that process as well as ensure that it covers the requirements of our statute. There's a separate exam that pharmacist applicants in California also take. It's that NAPLEX, and that is really done through the National Association of Boards of Pharmacy. By law, there's no crossover in those types of topics. So I don't know that I can give you a cause and effect for why the pass rates on the NAPLEX are decreasing, while in California we're seeing an increase. It's definitely something that we're looking at, but because there's a lot of confidentiality with respect to exam administration, we can see the trends, but we might not necessarily be able to identify what those impacts are. I hope that answered your question.
Yes, thank you.
Any other questions for Ann? All right, seeing none, we'll go for public comment. Thank you.
All right, this is the moderator. We've opened that Q&A panel. If you'd like to make a comment on the presentation provided by EO Sodergran, please click on that Q&A panel and type the word comment. For our call-in users, you may dial *3 to raise your hand. And seeing no requests for comment, would you like me to close the panel?
Thank you, Shelley. And I cannot say enough how much we appreciate your hard work, and she works every day, every night, late nights, every weekend. I don't know how this person does it. We are just so thankful, and for all you do. Thank you, thank you, thank you. Okay, with that, that is all basically, but unfortunately, I guess we were hoping to have Kula join us. Kula unfortunately is not joining today. I thought she was gonna show up for today. Today is her last meeting. She is unfortunately decided to resign just due to too much time commitment. We enjoyed having Kula. She was a great energy, and we will miss her. And as already announced, Ricardo this is his last meeting. But also, with true sadness, that I am announcing that our assigned counsel, Ms. Smiley, will also be leaving. She was assigned to our board during an extremely busy time at the beginning of the COVID-19 public health emergency, with waivers and everything else that came between. She has, since your first day with the board, you have provided just thoughtful counsel to the board through some extremely difficult and complex issues. We are truly grateful for all your efforts to support this board. Your commitment to the board and California consumers is notable, and we will miss you and wish you continued success as you move on. And we don't have any closed session items, but I'm going to have Eileen, just want to make sure you say something to make sure that we close any gap. For your last words there, very fitting.
My last words, it's been a pleasure working with all of you on the board, for the former members, and of course with Anne. But the last thing I'll do officially, as you already mentioned, President O, is that the board finished its closed session matters yesterday with the items that were listed. We are not meeting in closed session today for agenda item 18, and we are not discussing subpart C either today, and we didn't discuss it yesterday. And with that, we could adjourn. I'll turn it over to you to adjourn the meeting.
Thank you, Eileen. Anyone else want to say anything before we go? Not seeing anything. Okay, I guess that's it. Thank you, everyone, always. Really appreciate all your time. I know this is the 460 pages of the enforcement chair report is, we kill a lot of trees, but to do the right thing for California. So I appreciate all of you. Thank you, all of you, always. And I will see you all in about a month.
Thank
Stay
you.
safe.
Thank you.
Bye.